As a UK doctor in the US for a fellowship, you work with a pharmaceutical company that pays you for prescribing their drug. However, you know better alternatives exist for your patients. How do you handle this ethical dilemma?
Okay, so there's a clear ethical dilemma here. On one hand, I've got a financial agreement with this pharmaceutical company, but on the other, I know that something is better for my patient. There's a clear conflict of interest here. However, as a doctor, main priority should be my patient's well-being. So it's really important to disclose this financial agreement. One of the most important things about being a doctor is maintaining trust and open communication with your patient as described by the GMC. This allows to build a good patient-doctor relationship. This rapport is so essential in patient care because studies have shown it increases patient compliance and adherence to treatment, which therefore increases clinical outcome. Furthermore, autonomy, one of the 4 medical ethics, has to be considered here. Every patient should have the right to choose their own treatment, and this can only be done if they have all the necessary information to make such a decision. By disclosing my conflict of interest, the patient is able to consider lots of different factors and make the choice that is right for them. After disclosing my financial agreement, I would go through the different drugs available with my patient. I'd explain the benefits and explain the risks. Here it's also important to consider beneficence and non-maleficence. Beneficence means do good. I have to prescribe the drug that would be best and work around their lifestyle, perhaps their mental health, perhaps their religious and cultural beliefs. Also, could the prescribing this drug be harmful to them? This would go against non-maleficence, which means to do no harm. In summary, the financial agreement between me and the pharmaceutical company must be disclosed to the patient so that they can make informed consent. Patient care should not be focused around financial incentives, but the patient themselves to ensure that they get the best care possible for them.
Artificial intelligence in healthcare is unethical and risky medicine. Discuss points for and against this statement.
Recently, we've seen a huge increase in the use of AI technology within healthcare. I think it's undeniable that it has the promise of being a really powerful tool for physicians, for example, in computational diagnostic. It can therefore be argued that from a beneficence perspective or the ethical pillar to do good, using AI is the right, justifiable thing to do. However, there are other ethical concerns and risks that have to be addressed. The first one being patient confidentiality. Sensitive medical information would have to be inputted into the AI, making it susceptible to data breaches. This risk can be mitigated, however, by ensuring the data is encrypted and there is safe data storage. Another consideration is patient autonomy. If they are not fully informed about the use of AI, this could breach their right to their own informed decisions about their healthcare. Therefore, it's really important to educate the patients where relevant in their treatment so that they have all the information necessary in order to make an informed decision. Another risk is malfunction. Just like any other technology, AI could make mistakes which have the potential to be fatal in a medical setting. This directly goes against non-maleficence, the ethical pillar of doing no harm. However, it could also be argued that doctors make mistakes. Actually, AI has been shown to be just as accurate, if not more accurate, as doctors in things such as pathology and identifying cancerous cells. Therefore, it can be argued that while AI doesn't come with the guarantee of no mistakes, it definitely has the potential to reduce them. Another risk is bias. If the data used to train the AI is biased, then each output will also be biased. This could lead to inequitable care. However, by ensuring the AI is trained with unbiased data from various ethnic minorities, social classes, sexualities, etc., and through constant monitoring of the AI, this risk can be mitigated. Furthermore, it can be argued that subsequently the decisions and outputs made by the AI will continue to be unbiased, reducing the risk of human bias when making these decisions. There are also concerns that AI would compromise the patient-doctor relationship. Medicine is not only about science, but human empathy and emotional intelligence. The patient-doctor relationship is really important because without that rapport, patient adherence to treatment suffers and so does clinical output. However, I think there needs to be a change of view. from AI not replacing doctors, but aiding them. For example, radiologists use AI to detect abnormalities, but it is them who make the final decision and communicate that to the patient and discuss care options. This ensures that it's a human at the forefront of a patient's care, not a machine. So in summary, there definitely are ethical concerns surrounding AI, such as confidentiality, autonomy, the patient-doctor relationship. But there are also so many benefits it can bring, and these risks can be mitigated. I think the use of AI is exciting, and it can definitely be used to provide better patient-centered care.
In cases of organ transplantation, priority should be given to patients who are registered as organ donors over those who are not. Discuss the ethical implications of such a policy.
So organ transplantation is when someone allows their organs to be removed and implanted into another. It saves the lives of so many who are suffering with terminal organ failure. However, the demand is far greater than the supply of organs. Prioritizing those who are registered donors for these transplantations definitely incentivizes the process. From a utilitarian ethical view, this is entirely justified, as this policy would increase the number, potentially, of organs available for transplantation, maximizing the greater good. However, there are other ethical concerns that need to be addressed. For example, patient autonomy must be respected, as it is a patient's right to make individual decisions about their healthcare. Many people choose not to become organ donors for reasons such as religious reasons. People should not face discrimination in healthcare due to these choices. Furthermore, people may feel pressure to become organ donors against their will. This is not right. Another medical pillar is justice. Everyone deserves a right to equitable healthcare. Speaking of equitable, organ allocation should be based on clinical need, not whether they're on the register. In order for a successful organ transplant, the organ has to be compatible. Otherwise, you run the risk of rejection, which is an autoimmune response which can cause serious harm to the patient. This not only goes against non-maleficence, or to do no harm, but also wastes an organ that could have been used to save somebody else's life. Another concern is the impact of the public view of the NHS if such a policy came into place. On one hand, rewarding organ donors would show that the NHS is dedicated to tackling organ shortage, but on the other hand, it could create a narrative that the NHS is unjust. Non-donors may feel reluctant to go and see medical professionals as they may be subject to judgment and bias. This would severely impact the health of this demographic. So in conclusion, I think while this policy definitely could be used to increase the number of organ donors, it is a controversial policy. There are other options that could be used to increase the number of donors, such as public awareness campaigns and education in schools. However, organ allocation should primarily be based on clinical need.
As a medical student, you are assigned to a team led by a surgeon, and you observe the surgeon make inappropriate and disrespectful remarks about a patient's headscarf to the patient. How do you address this ethical issue?
The comments made by the surgeon raise many ethical concerns surrounding the patient's right to fair and non-judgmental treatment, patient autonomy, cultural competence, and professional integrity. The words could have affected the patient's trust in the NHS or make them feel further marginalised. It's therefore important to address this issue effectively. First, in a quiet moment, I would approach the patient and check up on them and see how they're feeling about the situation, and also try and ascertain exactly what the surgeon said. It's important to raise the issue with the surgeon respectfully, as otherwise this could damage the chances of a collaborative outcome. As a medical student, there are certain respect and seniority boundaries which make it inappropriate to publicly call out the surgeon. If I feel comfortable, I may approach the surgeon privately and discuss why the comments may have been disrespectful and the potential impact on the patient. This way, there is a more collaborative environment and professional respect is maintained. However, if I didn't feel comfortable, I may speak to a trusted member of staff or doctor and gain their advice. It may also be appropriate to report this incident to the ethics committee within the hospital. so that the surgeon may be educated if necessary. It is really important that medical professionals are competent in diverse practices. The UK is becoming increasingly more diverse, which is something to be celebrated. And doctors need to be aware of different religious and cultural beliefs in order to provide more patient-centred care. Furthermore, a study done in April 2023 showed that over a quarter of NHS staff were from ethnic minorities. Respect of colleagues' religious, cultural practices is inducive to a more collaborative environment and a better team dynamic, which in turn results in better care for the patient. Calling out inappropriate comments, especially when made by a person in seniority, may be uncomfortable, but ignoring it is ethically wrong and not conducive to an inclusive NHS environment. While speaking out against inappropriate comments may feel uncomfortable, especially when it came from someone in seniority, it is unethical and detrimental to ignore it, as this can ruin trust between patient and doctor and also within the medical team, which will impact the patient's care. If done promptly and effectively, speaking out can minimise damage and help work towards a more inclusive NHS.
A 17-year-old with severe anemia from chronic kidney disease requires blood transfusions. The patient's parents refuse based on their religious beliefs. The medical team believes that the treatment would significantly improve the patient's chances of survival. How would you approach this ethical dilemma?
So there is a clear ethical battle between respecting the patient's autonomy, which is the right to choose their own treatment, and beneficence, or the ethical pillar to do good. The first thing to consider is the patient's age. They are over 16, so have the right to make their own decisions about their treatment. But it's important to measure their capacity, which is ensuring they are able to understand all the information around the decision, retain it, use it to form a decision and relay it back. If the patient was deemed not to have capacity, I would speak to their parents. I would pull them into a private, respectful conversation and try and determine their religious views and also explain to them the need for the treatment for their child's well-being. I would perhaps also include a religious leader in order to gain more insight. I would speak with a multidisciplinary team of perhaps my seniors and consultants and also child psychologists and nurses to try and see if there are any alternative treatments that would align with their religious beliefs. If there's no conclusion reached, I would then take it to an ethics committee who can then weigh up the principles, again, of autonomy, beneficence and non-maleficence and come up with a conclusion. Ultimately, this is an ethically complex case, but my aim as a doctor would be to try and approach it from a holistic point of view.
In the context of global health, developed countries often have better access to medical resources than developing countries. What ethical responsibilities do developed countries have in addressing global health disparities?
So global health disparities refer to systematic differences in healthcare systems between developed and developing countries. We in the UK are lucky enough to have access to state-of-the-art infrastructure and education. This is not the case for some developing countries. One of the 4 pillars of medical ethics is benevolence, or to do good. This extends not just to our own country, but to global health. One way we can help to reduce these global disparities is humanitarian aid. Charities such as Doctors Without Borders fly out and help during conflict, natural disasters, and epidemics where healthcare treatments and professionals may be limited. Another thing we can do is donations. There is a charity called OrthoCycle which collects boots and braces which aren't used in the UK and distributed to hospitals where these kind of things are luxuries. And these can be used over and over in these countries, helping to aid an exponentially larger number of people than they can in the UK. This not only reduces medical waste, but again, maximizes the good. However, I think one of the most powerful things we can do as doctors is education. Like the famous quote goes, give a man a fish, you feed him for a day. Teach him how to fish, you feed him for life. During work experience, I was lucky enough to speak to doctors who flew out to Gaza and not only provided healthcare treatments, but also educated the local doctors on how to replicate them so that this could be sustained long term after they came back. It's also valuable to educate the public about healthcare. For example, there have been many campaigns done in rural African villages to teach them about safe use of contraceptives. This has dramatically reduced the incidence of STIs in this area. However, not only can individuals make a change, but we can work together as a healthcare system. For example, healthcare systems can invest in infrastructure, whether this be something small like water pumps or large hospitals. It's also important that we advocate against corruption and socioeconomic disparities within these countries. Also, aiding or getting involved in collaborative research between developed and developing countries can have a dramatic effect, such as the Global Polio Eradication Initiative, which was done in Pakistan, which has dramatically reduced the incidence of polio in this area. It is important, however, that while giving aid, we take into account the religious and cultural beliefs of the country. Also, we have to make sure that we aren't taking a paternalistic approach where the developed take superiority over the developing and instead work collaboratively. There are short-term solutions to help disparities, such as providing immediate healthcare aid and donations, but in order to make huge changes and reduce global disparities for good, it's really important that we come together as healthcare systems to educate and invest in infrastructure so that they can be self-sustaining.
A terminally ill Alzheimer's patient expresses their wish to participate in a medical trial for an experimental Alzheimer's treatment. However, their condition poses challenges for them to fully comprehend the potential risks and benefits of the trial, including memory problems, reasoning difficulties, and mood changes. What should you consider before enrolling the patient?
Informed consent is extremely important when making a good decision with a patient. In order to make informed consent, the patient must have capacity to make the decision. Guidelines for assessing capacity are clearly written in the GMC, and they involve ensuring the patient can understand all the information relevant to the decision, retain that information, use it to make a decision, and relay their decision back to the healthcare professional. If it's deemed that the patient has capacity, it's really important to respect their decision, as this aligns with patient autonomy. If the patient is deemed not to have capacity, I would check to see if they had a lasting power of attorney, an LPA. There is a legal document that some people sign while they still have capacity, assigning an LPA to make medical decisions on their behalf if they lose capacity. If there is an LPA, I would work with them collaboratively to try and find or weigh up the pros and cons to ensure that we're making the best decision for the patient. If there is no LPA, I would speak to the patient's family and try to understand what the patient may have wanted. I would also weigh up the pros and cons of the experimental treatment. I would reach out to perhaps seniors if I was still unclear of what the ethical thing to do would be, or maybe even reach out to those involved in the trial to try and get more information to make an informed decision. Ultimately, it's really important to respect the patient's autonomy, but also consider beneficence, or the duty as a doctor to do good, and non-maleficence, to make sure you aren't harming the patient.
As a medical student, you witness a colleague falsifying information to fill up a patient's notes due to fear of being reprimanded by a senior for not taking a complete history. How would you respond to this situation?
I must consider patient safety and professional integrity. While I can appreciate why my colleague may feel fear, patient safety will always be my top priority. The first thing I would do is immediately go and check up on the patient to see if they are okay. And when all is fine, I would approach my colleague in a non-confrontational way and explain why they did was completely unacceptable. I would maybe listen to their concerns, because perhaps they have some mental health issues or work stresses that force them to act this way, maybe help them find a way to deal with this. After this, I would have to report this incident to the relevant ethical committee. This is because this may be a repeat incident, and it's really important to review all patient history to ensure that no harm comes to any of the patients. Again, as a medical student and as a human, I can understand why some people act in a certain way when they feel scared, but as doctors, it is our duty to always prioritize patient safety. Otherwise, this directly goes against non-maleficence or the duty of a doctor to do no harm. And this could potentially be a very dangerous situation.
When treating patients with mental health conditions, involuntary hospitalisation and treatment may be necessary in some cases. Discuss the ethical considerations surrounding involuntary psychiatric hospitalisation.
The first pillar of medical ethics to consider is autonomy. Patients have the right to choose their own treatments provided they have capacity. This is something that can be assessed. You have to make sure that patients are able to assess and understand all the relevant information around the decision, retain it, use it to make a decision and relay that decision back to healthcare professionals. If the patient is deemed to have capacity, other options can be considered, such as outpatient therapy. But if not, it's really important that they are involuntarily hospitalised if that is what is required. Beneficence means to do good. Perhaps by involuntarily hospitalising these patients, they will have access to the medication and the support they need, which they would not get otherwise. Non-maleficence is another one to consider, which means to do no harm. Many psychiatric patients may have severe depression or suicidal thoughts, which could lead them to harm themselves, or maybe hallucinations, which may lead them to harm others. It's really important that this is considered when deciding whether a patient should be hospitalised or not. Finally, justice. Justice is the right to fair and equitable treatment for all. In terms of justice, the law supports doctors in hospitalising them if necessary, for example, with the Mental Health Act. This way, they can keep the patients inside the wards and give them the best care that they require. In summary, when considering patient autonomy, beneficence, non-maleficence and justice, it is clear that sometimes involuntary hospitalisation is the best course of action in order to provide these patients with the care they need to get better.
A man has terminal lung cancer that is not responding to any cancer treatment. The consultant in charge relays that the best course of action is to stop treatment and to manage palliatively. However, his wife insists on continuing treatment. If you were the physician, how would you navigate this dilemma?
So obviously this is a very emotionally charged, sensitive topic which has to be dealt with care. Palliative care may be the best option in this scenario because cancer treatment can be very harsh and lead to diminished quality of life, for example, through hair loss and nausea and loss of appetite. It's important to explain these to the patient and to the family so that they fully understand the pros and cons of going through treatment compared to palliative care, in where they would make the patient as comfortable as possible and take into account lifestyle, spiritual, religious beliefs so that they can have the best end to their life. The first thing to consider is, of course, patient autonomy. Every patient has the right to make their own decisions provided they have capacity. The GMC clearly has guidelines on how to assess capacity, and this is by ensuring they can understand all the information relevant to their decision, retain this information, use it to make a decision, and relay this decision back. If the patient doesn't have capacity, I'd look to see if they had an advance directive, a document which would have been made while the patient did have capacity, stating what kind of treatment they would like to refuse or have. This could provide some guidance. Alternatively, they may also have lasting power of attorney, someone appointed to make medical decisions on their behalf. If they did have an LPA, I would work with them collaboratively, taking into account what's in the patient's best interest, as this aligns with beneficence or to do good. It's important to explain these to the patient and to the family so that they fully understand the pros and cons of going through treatment compared to palliative care, in where they would make the patient as comfortable as possible and take into account lifestyle, spiritual, religious beliefs so that they can have the best end to their life. In conclusion, it's really important to consider patient autonomy, beneficence, and also non-maleficence when taking this into account, and looking at the patient holistically and deciding what would be best for their quality of life.